None of us could have imagined how we would all be tested by a once-in-a-century global pandemic and the unprecedented turmoil it has caused. The lives and livelihoods lost, the unimaginable personal and economic hardship. We stepped up and rose to the occasion by bringing to bear the entire arsenal of government and public health. We mobilized the citizen soldiers of the Maryland National Guard to lead strike forces into nursing homes, to save the lives of our most vulnerable, to stand up surge tents at hospitals, to transport life-saving equipment, and to administer tests and vaccines. When no state in America had any testing capacity whatsoever, we led by building an entire testing infrastructure from scratch. When hospitals were overflowing, we added 6,000 additional surge beds and stood up new field hospitals. When we needed to reinforce our beleaguered healthcare workforce and emergency personnel, we activated the Maryland Responds Medical Reserve Corps and called retired nurses and nursing students into action. We built mass testing and vaccination sites all across the state and established the nation's first vaccine equity task force to get shots into arms in hard-to-reach and underserved communities. Together, we have led one of the strongest health and economic recoveries in America, thanks to the heroics of our healthcare workers, our emergency services personnel, National Guard soldiers and airmen, and the resilience of our small business community and all the people of our state who came together, looked out for one another, and who answered the call to be Maryland strong. We have now spent nearly 2 years fighting this virus, and it has taken far too much from us, including, sadly, 13,316 of our fellow Marylanders. But tonight, there is hope, because with swift and decisive actions and the vigilance of Marylanders, I'm pleased to report that we have turned back another dangerous variant of COVID-19, and tomorrow, the state of emergency will end in Maryland. Our long-term public health response will continue. Our surge capacity, our testing and tracing operations, our vaccine clinics, all those things will remain in place as part of an ongoing operation of government. But my message to you tonight is that we must all learn to live with this virus, not to live in fear of it. We can't let it continue to dictate how we live our lives. Our offices and businesses need to be open. Our kids need to be in school, in person. Of course, we'll continue to follow the data and the science, and we'll keep fighting back with everything we've got. But make no mistake about it, we are moving forward, full speed ahead, and we will continue to lead the nation in both health and economic recovery.